Unfortunately, Dr. Di Marco could not be here, so I'm Miriam Duso. I'm here to talk about what we do in our University of Padua gait laboratory. We have we're studying gait pattern with patients with Dravet Syndrome. What we saw is that there are two patterns, polyflexed and adult-like. Unfortunately, not all the kids, not all the patients with Dravet disease can undergo a full gait analysis because of the lack of the necessary degree of cooperation. So our idea was that using foot pressure maps could be an aid to gait characterization. Using the pressure platforms that we already had in our gait laboratories. The variables we calculated in our 9 patients and 7 controls were the contact area, the average force, contact time, mean pressure, peak pressure, and maximum force. These variables we calculated on the footprints that were obtained by making the patients walk on the pressure matrices. And these footprints were then divided in areas in order to study them thoroughly. You see the areas in the boxes. It's the forefoot, the midfoot, the rear foot, lateral and medial foot, and also the whole foot. We obtained, as a result, we saw the reduction of the lateral force of the foot, the bilateral reduction of force of the rear foot, and a roughly overall increase in contact time bilaterally. So, the reduction of the lateral force of the foot that is associated with a flat foot condition, as we see in the photo, is and also associated with a reduced rear foot force. This reduces the lever and reduces the propulsion, so these patients need to seek an alternative propulsion in order to be able to walk. And they find it with the anteposition of their center of gravity. This means the anteposition of the trunk. But anteposition of the trunk also makes these patients more unstable. And this instability, we also see this by the augmented time of contact. So, since these signs that we also see with a full gait analysis can be, we saw that they can be supposed or presumed by the foot pressure maps, we can say that the foot pressure maps can be an alternative to full instrumented gait analysis in non-collaborative persons, such as patients with Dravet syndrome. Thank you.
Thank you.